program is Easy Access to Healthcare for All, a program which brings you news and issues around the National Health Insurance Scheme as it drives Nigeria towards universal health coverage. One major program that will fast-track the attainment of universal health coverage is the Basic Healthcare Provision Program that targets the vulnerable, aged, and the poor in our communities. For effective implementation of this program, the scheme organized a 5-day specific workshop for key officers, both from the scheme and from health insurance agencies across the North Central Zone. We'll bring you details of the training in our program this evening. I am Aisha Muhammad Ahmed, your anchor. Please stay tuned.
Easy access to quality healthcare for all. NHIS.
First on the program is a highlight of events around the NHIS. In the news, NHIS trains staff and stakeholders on gateway implementation in Benin, and the GMICT takes a bow.
In a bid to achieve universal health coverage, President Muhammadu Buhari on Thursday the 19th of May 2022 signed the National Health Authority Bill into law, which provides health insurance for all Nigerians. This much was announced in a press release by the Senior Special Assistant to the President on Media and Publicity, Malam Garba Shehu. The amended bill repeals the National Health Insurance Scheme Act, Cap N42, Laws of the Federation of Nigeria 2004. The bill reduces out-of-pocket spending for health services amongst Nigerians. In the statement, President Buhari said that a fund will be established to ensure the coverage of 83 million Nigerians who cannot afford to pay for premiums. The new act empowers the authority as well as state governments to develop information management alongside digital records that will enhance data collection, monitoring, as well as quality assurance, among other things. General Manager, ICT of the National Health Insurance Scheme, Prince Nasir Ikaru, recently retired from the civil service, having reached the retirement age of 60. The outgoing General Manager had served the NHIS for 17 years. A retirement party was held in his honor with family members, friends, and well-wishers in attendance. Former colleagues took turns to share their thoughts about him, eulogizing his work ethics and personality.
Prince Nasir Ikaru. He actually brought us together as a group and as a community. Before now, I didn't really know everybody from the Afumai of Edo State, but now they are more like brothers and sisters to me. So he initiated that and it has come to stay. So we are here to celebrate him as he exits his public service, and we wish him a peaceful retirement and life after retirement, and all the goodness, all the good things in life.
My brief encounter with the retiring GM has been unforgettable, to say the least. He was my general manager in marketing when he was brought to marketing briefly, very fleeting, before he was taken back to ICT. And all through the time he's been on the TMC, and I was also got onto the TMC, I can affirm that I've found that he's down to earth, and his humility is second to none. There's no one he can't interact with. He's not the kind of GM whose shoulders will be hanging up there and looking down on people. No. Is very approachable at any time.
In an interview after the event, Prince Nasir Ikaru expressed gratitude to friends and colleagues for celebrating him, describing his stay at NHIS as rewarding.
I came in to make a difference in terms of ensuring that there is an enabling environment that will create efficiency and effectiveness in the operations of the scheme. So that from the very beginning, I came in and I was employed to head the department of MIS at that time, called Management Information System. Later I was moved into the field. Going into the field gave me a lot of exposure about the operations and processes of the NHIS. And when I was brought back to Abuja headquarters to head the department of ICT, those processes and the operations of the skills I learned during the exposure in the field really helped in the design of the electronic NHIS business project that eventually we were able to now implement under Professor Mohammed Nasir Sambo.
The National Health Insurance Scheme recently organized an orientation workshop for State Oversight Committee (SOC) and board members of State Social Health Insurance Agency on the Basic Healthcare Provision Fund (NHIS) Gateway Implementation Guidelines in Edo State. The workshop was attended by members of State Oversight Committee members, which include the Commissioner of Health, the Executive Director, Edo State Social Health Insurance Agency, Executive Secretary, Edo State Primary Health Care Development Agency, and the Permanent Secretary, Edo State Ministry of Health, and other stakeholders. Speaking at the workshop, Raymond Uyo Homba, NHIS Edo State Coordinator, stated the importance of the orientation. He said the training was to ensure quality implementation of the program. There was a presentation by the representatives of the Informal Sector Department, ISD, where key areas of the implementation process of the Basic Healthcare Provision Fund within the approved practice pattern, policies, and procedures of the program were highlighted. After the presentation, questions and concerns were addressed. The Permanent Secretary, Edo State Ministry of Health, and the Executive Secretary, State Primary Health Care Development Agency, thanked NHIS for this lofty idea and promised to utilize the training received.
The program is easy access to healthcare for all. The attainment of universal health coverage is a major mandate of the NHIS, and one major way the scheme can fulfill this mandate is through the implementation of the Basic Healthcare Provision Fund program, as it caters for those who cannot pay for health insurance within our communities. In implementing the provisions of the fund, the NHIS is in partnership with the state health insurance agencies. It is to ensure seamless implementation and ensure everyone is on the same page that a 5-day training workshop for stakeholders in the implementation process was organized. The training for the North Central Zone held in Abuja recently. Let's get details of how it went in our next segment. Please don't go away.
Easy access to quality healthcare for all. NHIS.
The NHIS is the foremost agency in implementing social health insurance in Nigeria. It is intended to be the veritable vehicle through which Nigeria can attain universal health coverage. The scheme ensures people have access to needed key promotive, preventive, curative, and rehabilitative healthcare services in Nigeria. Health insurance thrives on pooled funds, but who pays for the people who cannot contribute for themselves? That is why the NHIS Basic Health Provision Fund (BHCPF) Gateway Program comes in, as it caters for the vulnerable segment of our communities. For better implementation of the fund and fulfill its mandate, the NHIS conducted a 5-day specific training workshop on the NHIS Basic Healthcare Provision Fund. The training had in attendance representatives from NHIS and state health insurance agencies who directly implement and monitor the program. Activities kicked off on Monday with account officers both within the scheme and the state health insurance agencies. Mrs. Mary Aliyu, Nasarawa State Coordinator, gave the opening remarks while she appreciated the leadership for the initiative.
Together, this capacity.
She said the collaboration with state health insurance agencies will help the implementation of the program and hasten the attainment of universal health coverage.
This is a very good one coming at this time that the NHIS and the state health insurance needs to come together and collaborate to achieve universal health coverage. We know that in fact, most often we have to relate with the state health insurance so that we can achieve our goals. And if we don't get to know ourselves like this, if we don't study these things and build capacity together, I don't see how we'll be able to carry out the very necessary functions. As I heard some of you said this morning, that they want to know more about the basic healthcare provision fund, where the resources coming from, the 3 gateways, and so on and so forth. So by coming together like this, we'll be able to study this, we'll be able to get to know more about it.
Moving on, there was a presentation on the general overview of the Basic Healthcare Provision Fund to help educate participants.
Basic healthcare is established under Section Part 1 of the National Health Act and is the main funding vehicle for provision of basic minimum package of health services. Basic minimum package of health services are those health services that we expect, of course, under this, when we talk about universal health coverage, the basic health services that we expect people to have, it covers as universal health coverage from preventive all the way to rehabilitative care. Okay, so the overall aim of the Basic Healthcare Provision Fund is to significantly move Nigeria towards the attainment of universal health coverage, as we mentioned earlier, using that's the National Strategic Health Development Plan 2, the medium term, and the health-related SDGs in the long term. You know, this National Strategic Health Development Plan, in the medium term and they have what we're trying to achieve in the medium term, that's improving maternal mortality, reducing maternal mortality, reducing neonatal mortality, and increasing life expectancy.
Events progressed with another presentation on financial policy and financial regulation by Baba Abdullahi from the Department of Finance and Accounts, NHIS.
Payment process. That means I'm not the only one.
The training continued with the Standard and Quality Assurance Department, discussing accreditation processes, quality assurance, as well as claims management under the Basic Health Care Provision Fund.
Accreditation as a gateway. Before they will say NHIS accredited facility, you must have your accreditation. It's a gateway. Without accreditation, no facility. If you are a provider, then you cannot participate in NHIS. That means it's a gateway for you. Without you being accredited, you cannot do anything with NHIS. So the first thing you do as a provider is what? For you to get NHIS accreditation. So that means it's a gateway for any facility that want to participate in NHIS.
Some other presentations were on grievances and redressals under the Basic Healthcare Provision Fund.
And then you have data-driven organizations.
The training ran throughout the week for ICT, monitoring and evaluation departments, as well as for the formal, informal, and enforcement departments.
All right, so
Mr. Ndaguba Okechukwu from the Basic Healthcare Provision Fund Division, NHIS, speaks on the core of the training and its essence.
we should train people on the specific thematic areas of BHCPF, financial, monetary evaluation, programs, ICT, so that everybody will know exactly how the program is supposed to work. And then both the state health insurance agencies and the state offices, so the state offices can do the oversight and the shares can do implementation, and nobody is left behind. We want first implementing actors with the capacity to do their jobs. which will also affect our own national outcomes. You know that part of this care provision fund, part of it is to achieve universal health coverage. So we don't want people to not to understand what we are doing. We want to be in line. And the spirit of health insurance under one roof. That is why we are carrying the state health insurance agencies along.
Facilitators at the training also shared their views further on the basis of the training.
What we're here to achieve is to train our staff in the state office, the SQA staff and shares on the basics of basic healthcare provision fund and what is expected of them, how accreditation, quality assurance and claims management under the basic healthcare provision fund.
When you talk of the implementation of the basic care provision fund, you cannot talk of implementation without talking of the monetary evaluation. Monetary evaluation is very, very important in the sense that it's monetary evaluation that will enable us to track that are we doing well or we are not doing well as far as implementing of this program is concerned. And this the fund is coming from the public fund, so definitely a time will come when people will be asking a lot of questions. What have you done with this money? So it's through the monetary evaluation that we'll be able to know what we've done with the money, how many people have been benefited, what is the rate of utilization, and what is the impact of this particular program at the long run.
This training is fantastic because in order to achieve the objective of the current administration of NHIS under one roof, it is necessary for us to go out, as we have done, to unify what we are doing. It's more like we are harmonizing efforts, both from the headquarters, the states, and the shares, down to the enrollees. We are doing one thing. Everybody is brought to the same page by this training, and so that when we are working, we are all working from the same document. We all understand the same language, and that's the essence of this thing. And this is one way of ensuring that this message of UAC gets even to the grassroots.
Quite a number of initiatives are being implemented by the NHIS to make Nigerians benefit from health insurance. Topping these initiatives is the training of staff and stakeholders to bring everyone on board so that Nigeria can attain universal healthcare coverage by the year 2030.
In the course of the training, our crew interacted with participants. They expressed their views on different issues as it relates to the training. Some participants laud the basic healthcare program, saying it is a medium for the attainment of universal health coverage.
This basic healthcare provision fund is a very laudable program of the federal government, and then we in Niger State we take it with much seriousness because it will help to provide access to quality healthcare for the vulnerable people in the states.
The basic health provision fund program is a laudable one. Our ears have found it necessary that all Nigerians should be under insurance program. And this one is for everyone, but particularly for the vulnerable ones in the society. For us to have a program for 1 week, you're supposed to know that it's business. We are not here for play. If it's different, people have been trained on different programs. Now we are in the program of M&E, and we have been trained on how to monitor and evaluate the program.
Some perceive the training as a right move in the right direction, as it will help in the implementation of the Basic Healthcare Provision Fund program.
As you can understand, is to build our capacity in terms of how this program is being run. It is one thing to ask for fund, something else to get this fund, but it's another thing to get a proper utilization of the fund. And that is why we say it is a 5-day specific training program. For today, it is the finance and account. You get this fund, but there should be proper utilization of this fund. This fund are divided into segments, percentage. You don't just start spending this fund and then eating what you're not supposed to spend it for.
First of all, it will increase learning and knowledge sharing, because we're also meant to disseminate this information at the back end when we get back to our respective agency. And concerning M&E, I think it will help us to monitor closely the BHCPF activities as it relates to measuring key inputs. And by inputs, I mean resources that are being put into the program, outputs, and by that I mean the activities being carried out, and the outcome, which is the result that is expected from this BHCPF, and that is by providing the basic minimum package for all Nigerians.
Some say it will help educate them on how to carry out their duties effectively when they return to their various offices.
The program is very enlightening. I learned a lot of things today. Besides, this is my first time on this program. And I learned more about the basic health itself, the implementation, and how it goes around. And I believe going back to National say, I will impart this only down to my people in office and even the ACP itself, those are the service providers, to know more about basic what they have not been doing before.
The training is timely. Because I'm new in the ICT department, I've been wondering how I would actually get on with the ICT. But with this training, it has actually opened my eye. So it has opened my eye to the doings of the ICT department, how vis-a-vis, the state health insurance and the NHIS, can work in synergy and seamless process of registration, and all the whole ENHIS process has just been explained to us, which we see that is so robust, and it's going to help the Nigeria health insurance go a very long way.
Participants further appreciate the NHIS for the collaboration with stakeholders and suggest that such trainings should bring various departments together.
I would have loved, if there's going to be such a training, you don't just come on a particular day, because the trainings are interconnected, and if you're not grounded, you get lost or you get confused. So if there's going to be a training, let it be a flow, so that even if you're not in the department, you should know what other departments are doing, so that you can speak for the agency as an individual.
It's a very laudable training. At least we are more enlightened. We are more educated on NHIS, BHCPF Gateway. We are enlightened about the ENHIS. At least it's a very laudable program, and I wish NHIS will come up with subsequent training like this, so as to enhance our capacity.
Participants at the training workshop for the Basic Healthcare Provision Fund there, expressing their views on the training they received. We will now take your questions in this last segment of the program.
Where do I register? How can I get enrolled? Where do I register? How can I get enrolled? How can I get enrolled?
Question: does NHIS cover delivery of commodities?
NHIS
when we talk about delivery, what NHS does is that there's a difference, a little difference, or when you say the word commodities of a wider range. So what NHS does is that it covers all the drugs and also the consumables. The word consumables are the ones that are more of medically related. Things like syringe and needles, things like gauze that they use during the delivery, things like cotton wool, and things like sutures that they use for suturing during the process. But other commodities like soap, like sanitary pad, like the diaper pack that they use to clean the baby, such type of commodities are not covered under the scheme. So I think the enrollees or our mothers that are going, that is to the maternity area, should get this thing clear, that it is only the consumables that are being covered.
Where do I register? How can I get enrolled? Where do I register? How can I get enrolled? How can I get enrolled?
Let's do this again, same time and same station next week. You can also watch the program anytime, any day via YouTube or any of our social media platforms on display. See you next week.